The American Association of Hip and Knee Surgeons have put together a basic rehabilitation program for patients to use after a hip or knee replacement. Please use the exercises as a guide, as it is ultimately between you and your surgeon to decide which therapy setting is right for your recovery after joint replacement. If you experience any abnormal discomfort, dizziness, or feelings of passing out, please stop exercising and contact your physician as soon as possible. Begin by placing a small rolled-up towel or small pillow behind your knee. Next, focus on keeping your toes pointed toward the ceiling and slowly push the back of your knee toward the floor. The muscles on the front part of your thigh will tighten. It is important to slowly control the muscle contraction and hold each repetition for at least 3 seconds before relaxing. You should perform 3 sets of 10 repetitions daily. Quad arc exercises are usually started when your knee can fully straighten. Begin with a bump behind your knee that allows your knee to comfortably rest with your knee bent. While keeping your toes pointed toward the ceiling, slowly straighten your knee. Hold the contraction for at least 3 seconds with the knee straight, then slowly relax the quadriceps muscle to allow your leg to return to the starting position. You should perform 3 sets of 10 repetitions daily. To make the exercise more challenging, a 1 to 2 pound weight can be placed around your ankle, or a larger bump can be placed behind your knee. Straight leg raises focus on the entire quadriceps muscle. To take pressure off your back, your opposite leg should be comfortably resting in a bent position. Think of this exercise as performing a more difficult quad set. Begin by tightening the quadriceps muscle with your toes pointed toward the ceiling, and then lift your entire leg off the floor while keeping the knee straight. Bring your leg up until your thighs are at the same level. Hold for 3 seconds, and then slowly control the leg as you move it back to the starting position. Aim for 3 sets of 10. This exercise can be made more challenging by performing more repetitions. For instance, 3 sets of 15. This exercise focuses on the hamstring muscles. Start by lying on your stomach. Remember to keep your thigh in contact with the ground at all times. Next, slowly bend the knee until the lower leg points toward the ceiling. During this exercise, focus on pointing your toes like you would when pushing on a gas pedal. Be sure to perform the exercise slowly and hold for 3 seconds before slowly returning the knee to the starting position. Aim for 3 sets of 10. Ankle weights can be added when this exercise becomes too easy. This exercise can be used for hip and knee replacement patients. Please make sure you are comfortable with getting onto your stomach if you have had a hip replacement before attempting this exercise. Heel slides strengthen and stretch the hamstring and quadriceps muscles. While seated or lying on your back, slowly bend your knee and slide your heel back toward your buttock until a comfortable position. Be sure to keep your knee pointing toward the ceiling at all times. Next, slowly push your knee straight until the back of your knee rests against the floor. Aim for 3 sets of 10. Socks may make it easier to slide your heel during this exercise. Hip replacement patients should discuss this exercise with their surgeon before attempting. First, start with both feet shoulder width apart. Next, push up onto your toes to raise your heels off the floor. Be sure to hold your heels off the ground for 3 seconds before slowly lowering your heels back to the ground. Aim for 3 sets of 10. These exercises should be performed next to a railing or countertop for balance. As the exercise gets easier, you can work on heel raises standing on one leg at a time. Hip exercises are important after total hip and total knee replacement. The hip abduction, adduction exercise can be performed a number of different ways. The first position is lying on your back. While in this position, keep your toes pointed toward the ceiling and slightly to your side as you slowly move your leg out to the side and then back to the starting position. After being able to perform 3 sets of 10, you are then ready for the next position. This stage involves standing next to a countertop or chair. Your leg should be rotated outward so your toes point forward and to your side. While keeping your balance, move your leg to the side, hold for 3 seconds, and then slowly return to the starting position. Aim for 3 sets of 10. The final stage of this exercise is lying on your side and bending your non-exercising leg at the knee. Begin with rotating your upper leg so that your toes are pointing to the ceiling and your leg is slightly extended. While keeping your knees straight, raise your leg toward the ceiling. Hold for 3 seconds at the top and then slowly return your leg to the starting position. Your goal should be 3 sets of 10. Ankle weights or bands can be added to any of these exercises to increase the degree of difficulty. Mini squats are an excellent exercise that focuses on regaining overall function after joint replacement. Begin with your back against a wall or smooth surface such as the door. Next, your feet should be shoulder-width apart and about 18 inches from the door or wall. Be sure to have a handrail or countertop close by to help with your balance. Start by slowly bending your knees and slide your back down the wall until the knees are at a comfortable bend. Now hold the position for 3 seconds and then slowly straighten your knees and slide your back up the wall. Concentrate to keep your knees directly over your toes during the exercise. Aim for 3 sets of 10. To make the exercise more difficult, you can use an exercise ball between your back and the wall. Hip replacement patients should discuss this exercise with their surgeon before attempting this exercise. Bridges are an advanced exercise that is usually started 6 to 8 weeks after your joint replacement. This exercise works the abdominals, low back, hips, and knees. Begin by lying on your back on the floor. Be sure to keep your feet flat on the floor and about shoulder width apart. Next, keep your hands at your sides and slowly lift your bottom off the ground. Keep lifting as high as you can until your stomach is in line with your knees. Hold for 3 seconds, and then slowly return to the starting position. Aim for 3 sets of 10. After a total joint replacement, it is also important to work on endurance exercises. Endurance is the ability to work over a period of time. Think of it as another form of strengthening during your recovery process that will allow you to perform your day-to-day activities without getting too tired. Walking, bicycling, and swimming build endurance by improving nerve impulses to muscles as well as improving your cardiovascular health. These types of exercises usually start about 4 weeks after surgery. Keeping up with these exercises 2 to 3 days a week will keep your muscles toned and your replaced joints working well. You can learn more at aahks.org/hipknee.